Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Persistent pain can be frustrating and exhausting. It can interfere with your work, your sleep, your emotional health, and your relationships. Not to mention, as the name implies, persistent pain is painful. But there are ways to manage that pain and take control of your life. Our guest today is Mary Sebas. She is a nurse practitioner in the internal medicine department at Mayo Clinic Health System. Mary, thanks for joining us today.
Thank you for the invitation.
Well, let's begin by defining what exactly is persistent pain.
Persistent pain is pain that interferes with your life for over 12 weeks. 3 months, 3 to 4 months. It's a pain that distracts you from doing your normal activities of daily living.
So it's pretty self-explanatory. Persistent pain, it's pain that persists, right?
Yes, and it is a pain that interferes. I think interferes is an important word because when you find that and when we say activities of daily living, we're talking about sleeping, exercise, food, socializing. When that pain interferes with those activities and you think twice about doing something, then we consider it persistent pain.
And can the pain come in different forms? Like when you hurt yourself, you cut yourself, you feel pain, or you burn yourself, you feel pain. Persistent pain, I'm assuming there's many different kinds of pain, right?
Oh, yes, very much so. There's neuromuscular pain, there's bone pain, there's nerve pain. There's also pain that we tend to be more sensitive when we're sleep deprived.
So what causes persistent pain?
It's a source, and that's oftentimes what the patient will come to the clinic for. It's a source that has multiple etiologies, and that is, it could be a bone pain, you're not bearing weight properly, you have muscle pain because the muscle spasms and then a nerve gets pinched. So there's oftentimes, when it comes to persistent long-term pain, it has multiple sources.
What is a neuropathic pain? I've heard of that.
A neuropathic pain is just as it sounds. It starts in a nerve root, and it can cause muscle pain, bone pain.
And can some people be more sensitive to pain?
Very much so. It all depends on your immune system. It depends on how much you've had to sleep, how much water you drink, how much rest you get, how much exercise you encourage yourself to be involved with.
So what does it mean to manage persistent pain? Does that mean when the pain can't be cured, ways to make your life more livable with the pain?
Yes, it's actually more comprehensive than that.
Okay.
There's no silver bullet. There's no magic fix to any one. We look at what's the source, and then we go to the source and say, okay, so is this neuromuscular? Is this an arthritis? Is this a vascular problem? And then we look at that and say, are there ways that we can improve the healthiness of that tissue or that joint? Can you bear weight better? Can you lose some weight so that you can move more easily? Should you do some exercises that give you a greater range of motion? And are there medications that could help you achieve this?
What about a pain journal? Explain what that is.
Yes, that's very important because that oftentimes we know that humans are really poor in their recall and their memory. So you usually only remember the very severest of pains, but we don't see how it comes and goes. So we recommend that people keep a pain log. So you can say at 8 o'clock in the morning, oh, my pain was on a scale of 1 to 10, 1 being the minimal and 10 being the very worst. We see where your pain is rated based on your perception. And then we follow it through the day. Oftentimes with someone else who has a caretaker, we'll have a caretaker keep a pain log as well, because it's really a perception issue.
And why is that important to keep that log?
Well, then it shows you where your most troubling times of the day are, and then also the activities that are associated, and also it helps us more specifically target our treatment.
So it's something you would share with your provider then?
Oh, very much so. And we keep it ongoing to see, did the intervention that we chose and we decided upon, did it make a difference?
What about lifestyle choices? Are there certain things in your life that you can do to help ease the pain or prevent it, or even in some cases cure it?
Yes, a lot of dealing with pain is perception and attitude. You have to have a can-do, I'm going to address this. Everybody gets tired, everybody gets fatigued and get overwhelmed. But we want to try to have a consistent approach to, yes, I can manage this. I can eat right. I can get my range of motion exercises done. I can drink enough water. I can get my sleep. I can eat properly.
And why are some of those things, like you mentioned, drinking water? Now, how does that help you manage pain?
Well, water is very important. You need to have enough hydration, especially if you don't have enough and you have muscle spasms from overdoing it. You can have lactic acid buildup, and you need to flush that out of your muscle tissue.
How about exercise?
Very important. That actually lubricates your joints, gets the metabolism in the muscle improves, and it gets your muscles to lengthen out when they're tight.
Do you find that often patients may be hesitant to want to exercise more because they do have pain? It's sort of a catch-22.
Oh, yes, because oftentimes we use the same group of muscles, so one group of muscles may always contract and the other muscle doesn't extend or lengthen. And so it is difficult initially to get those muscles that are stiff and contracted to extend. But once you do it on a regular basis, the muscles develop a memory for that, and they go, oh, I remember how to do this.
How about medications? What are some of the medications that are used to treat pain, persistent pain?
A very wide range. Most people only think of a few medications, and they think of over-the-counter preparations or something like an opiate, Vicodin or a Percocet. But those are actually very narrow scope. We use a much wider, we use muscle relaxants, we will even use antidepressants at times. We will use non-aspirin pain relievers. The key with using medication or any kind of intervention is that you want to do it consistently and the same time every day for at least 3 to 5 days. So you have what's called a therapeutic dosing, where we know medications only last a certain amount of time, and so you have to keep a therapeutic blood level of that medication. So if you just take it once in a while when it's really bad, that actually you're doing more harm than good.
And it doesn't have to be just taking a pill, right? There are other medications as well.
Yes, there are topical preparations. We have topical anti-inflammatory medications. We have topical pain patches that are like a topical lidoderm, those types of things.
How about alternative therapies? What are some of the alternative therapies that work for some patients?
They are very important. Acupressure, acupuncture, yoga, Pilates, cephalocranial work.
Are there certain ones that work better than others, or does it just really depend on the patient and the type of pain?
It does depend on the patient, and that's a very good question. It really depends on what you've tried in the past, what you know works for you, and also who you have a partnership with in your family, in your community. You may have a belief in your spiritual or your religious faith with someone who does a certain type of therapy that if that works for you, then try it.
So someone has persistent pain. They haven't seen their doctor yet. At what point should a person experiencing persistent pain come in to see their healthcare professional?
If you decide not to do something because of pain, if you say, oh gosh, I'm going to take this car because I'm not going to step up into the truck today. I can't put my elbow up and pull myself into the truck. Or, gosh, I don't think I'm going to go dancing because I'm really stiff and too sore. Or I'm not going to go for a walk with my grandchildren, or something of that sort. When you decide not to do something, that's the time to come in.
First time coming to a provider, someone with persistent pain, what should they expect?
They should expect to have a very good history taken. History is 90% of your exam. We want to look back, and we're going to take time, and we're going to go over and draw a calendar to say, how long has this been going on, and how severe, and when did it get worse? What made it better? Do you have any family history of any type of diseases or illnesses that may be inherited? Or did you have a trauma of this in the past? What did you do for rehabilitation in the past, and what could we do now?
It's probably important to point out, like you pointed out earlier, often there is no silver bullet either. When they come in to see a provider, the pain's not going to be cured right away.
Well, oftentimes, the pain didn't get there overnight either,
Right.
Unless it's a trauma or an acute injury. But the key is we have to get away from the thought of that there's one thing that's going to make this better. It really needs to be a comprehensive, multifactorial approach.
So Mary, tell me a little bit about some of the different medical specialties that help patients with persistent pain.
I really rely very highly on the other specialists that I have at my access. one of which is podiatry. We have access to podiatry, and I have them look at a person's feet. And especially if you have fallen arches or you have high arches, you may roll your ankles out, you may have ankle injuries. And so I rely on my podiatrist and my podorthist to take a look at the feet and say, is there an arthritic problem in the foot? Do they need special arch supports in their shoes? Do they need special shoes fitted just for them so they can participate in their activity? I would also use orthopedics. I have them, if a joint isn't getting any better and we did the basic studies on it, I would want a second opinion from orthopedics. I also use the rehabilitation department extensively. They also can look at where are your muscle weaknesses, muscle strengths, your tendons and ligaments that may be damaged or be too tight, that's not allowing you to function fully.
For folks that have persistent headaches, that sort of pain, would you also then
Yes.
see neurologists then?
Yes, we have neurologists and we have physiatrists who deal with chronic pain. The other piece is I do use, especially with headaches, I do use physical therapy. We oftentimes carry a lot of the stress that happens with headaches in our upper chest and upper back, especially with computers, anything that brings you forward. That's a physical problem that's not just, the symptom may be the headache, but we may need to include physical therapy or physiatry.
You know, that's a good point too, because a lot of people may think, well, physical therapy, it's for someone who's had an injury or is post-surgery, but it's also for folks that have persistent pain, not from those things, right?
Oftentimes, unless you're a regular athlete that you work out on a regular basis, many of us are deconditioned. And that means that we use the same group of muscles again and again and again. So those muscles do all the work, and then the opposing muscles are weak. And so we get deconditioned. We tend to slouch. We tend to move forward. We tend to give in. And so oftentimes I will say when somebody has that kind of a posture issue, I can actually put the diagnosis of deconditioning.
So Mary, how about follow-up? Obviously, this is a journey. Managing your persistent pain is not something that, like we said, you come in and you're cured overnight. This is a journey. Talk a little bit about that process.
Yes, it's looked at it as a long-term health issue, and it's on your chart as a long-term health issue. And we follow it, we monitor it. We say, how is your pain doing? You know, are you able to get out and exercise? Were you able to go and walk in the park with your children or your grandchildren? Were you able to go on that bike ride? Or did you go on that trip that you wanted to go on? And if you had difficulty, we follow up and we look at that and we say, okay, so what could we do differently? What worked? What didn't work? Oftentimes we find that when people start to get healthy, they start to say, oh gosh, you know, I feel better when I go for a walk, or I feel better when I ride my bike to work, or I feel better if I've lost 5 or 10 pounds. Oh, all of a sudden, you know, I'm picking more fruits and vegetables to eat, and gosh, you know, I forgot how much I really like broccoli. And they find a couple different recipes for broccoli. Then you start talking to people about, oh gosh, you start to garden and you get exercise in your garden. It's a positive feedback loop. What happens when people start to sleep better and they start to exercise, they start to eat better, they lose weight, they get more active. And it's really a positive swing of the pendulum.
So Mary, we're just about out of time. Before we go, any last words of wisdom for us?
Yes, if you want to manage your pain, we can walk beside you and help you. It's really, it's something that we can do together. It may take some time. You may have some successes. You may have some challenges. But we have a great team that I work with that can help you.
And there is help there. That's the big message.
Oh, very much so. There is. You should never give up hope.
All right, great. Well, I'd like to thank our guest today, Mary Sebas, a Mayo Clinic Health System nurse practitioner in the internal medicine department, for joining us today on Speaking of Health. A great topic and a great job. Thank you.
My pleasure.
Have a great day, everyone, and be healthy.